Hi everyone, I'm Katharina Kang, Mission Programs Manager at Komen, North Texas. Welcome back to our monthly educational series. If you missed any of our previous episodes, be sure to check it out either on our Facebook page or our YouTube channel. Just search for Komen, North Texas. When people think of Susan G. Komen, most people think of the race for the cure, or they think of the work we do in breast cancer research or in providing breast health services to women. But as one of the only organizations fighting breast cancer on all fronts, there is another important piece of the work that we do, advocacy. Today we are talking about Komen's Advocacy Summit that was held in Washington, D.C. earlier this month. From May 1st through the 3rd, the Susan G. Komen headquarters hosted the 2019 Advocacy Summit to prepare approximately 300 affiliate staff, board members, volunteers, survivors, researchers, and other breast health advocates for legislative visits to members of Congress. Communicating with federal and state policymakers is a key component of passing crucial breast cancer legislation and championing increased funding for research and screening programs. This means that Komen, as a patient advocacy organization with firsthand knowledge of how breast cancer touches local communities, must engage policymakers and government as partners in our efforts to end breast cancer forever. Komen does not endorse any political party or support individual legislators, but rather advocates for policies that save lives. All Komen advocates participated in a training that included information on Komen's public policy and advocacy team, an overview of Congress and the legislative process, a recap of the current political landscape, and an overview of Komen's advocacy priority issues. These are the key messages that participants were going to discuss with their legislative officials during congressional office visits, and we want to share those with you today. The first issue was ensuring access to breast health screening services. Without access to breast cancer early detection programs, many uninsured and underinsured women are forced to delay or forego screenings, which can lead to late-stage breast cancer diagnoses. This delay can mean that a woman won't seek care until the cancer has spread beyond the breast, making it much harder to successfully treat. The National Breast and Cervical Cancer Early Detection Program, NBCCEDP, provides potentially life-saving breast cancer screening and diagnostic services to low-income, uninsured, and underinsured women who do not qualify for Medicaid. Ensuring adequate funding for critical safety net programs like the NBCCEDP is key to ensuring all women have access to vital screening services. Members of Congress were asked to preserve women's access to breast cancer screening and diagnostic services by funding the NBCCEDP at $275 million in fiscal year 2020 budget. The second issue is investing in the cancer treatments of tomorrow. The National Institutes of Health, NIH, and its National Cancer Institute, NCI, have played a role in every major cancer prevention, detection, and treatment advance, while also delivering scientific breakthroughs for many other diseases for decades. Since 2004, the NIH budget has failed to keep pace with medical inflation. So as a result, fewer competitive research project grants are being awarded. Biomedical research is a wise investment that will not only defend Americans against breast cancer and other diseases, but also serves as one of our nation's primary paths to innovation, global competitiveness, and economic growth. Members of Congress were urged to make biomedical research an unwavering national priority by increasing funding for the National Institutes of Health at $41.5 billion in the fiscal year 2020 budget. The next issue is increasing access to diagnostic breast imaging. Diagnostic breast imaging is typically non-invasive and often used as a follow-up test after an abnormal finding on a mammogram or clinical breast exam. They are pivotal in the process of detecting breast cancers early. If women are unable to afford the costs associated with diagnostic imaging, many might delay or forego additional tests to rule out or confirm a breast cancer diagnosis. This delay can mean that a woman won't seek care until the cancer has spread beyond the breast, making it much deadlier and much more costly to treat. According to a recent Susan G. Komen Commission study, an average patient cost for a mammogram is $234 and $1,021 for a breast MRI. Members of Congress were encouraged to support legislation that increases access to medically necessary diagnostic breast imaging by reducing out-of-pocket costs for patients. This legislation is called the Access to Breast Cancer Diagnosis ABCD Act, House Resolution 2438. The last issue was reducing insurance barriers to treatment. While intravenous IV drug therapy is the most well-known component of cancer treatment, an increasing number of drugs today can be administered orally. The problem is that when intravenous therapy is covered under medical insurance, oral therapy is covered under pharmaceutical insurance. So in addition to having to meet the deductible for medical insurance, patients who need oral therapy would also have to pay high co-pays until they meet their pharmaceutical insurance deductible. This separation of coverage between intravenous and oral drugs causes oral drug costs to be much higher, which can be a factor when a patient is choosing their treatment path. Patients should not be forced to choose a less appropriate or effective treatment option simply because an insurer provides less coverage for a cancer drug that happens to be administered by mouth rather than intravenously. Patients and their physicians should be free to make treatment decisions based on what is best for that patient, not what the patient can afford. Members of Congress were urged to ensure breast cancer treatments can access the treatments they need to save their lives by becoming a co-sponsor of the Cancer Drug Coverage Parity Act, House Resolution 1730, Senate Bill 741. By the end of the day on May 2nd, summit attendees had completed approximately 400 congressional office visits, providing information on these 4 issues. Komen, North Texas completed office visits with staff from Senator Ted Cruz, Representative John Radcliffe, Representative Van Taylor, Representative Michael Burgess, Representative Mac Thornberry, and Representative Jody Arrington's offices. The staff were very receptive to Komen's messages, and the affiliate will continue to follow up with these legislators, urging their support for these life-saving breast cancer issues and legislation. We are committed to ensuring our elected officials hear the voices of their constituents on these important matters, and we'll keep you updated on the progress of the issues we raised at the Advocacy Summit. If you're interested in getting involved in our advocacy efforts or want more information, please visit our website at KomenNorthTexas.org or Komen.org. For our Komen Scholar Spotlight this month, we want to introduce you to a researcher working right here in Texas. Abena M. Brewster, MD, MHS, is a tenured professor in the Department of Clinical Cancer Prevention at the University of Texas MD Anderson Cancer Center, MDACC, and an adjunct in the Department of Epidemiology. She is a medical oncologist in the Nellie B. Connolly Breast Center. Her research focuses on investigating the role that tumor genomics and genetic susceptibility play in influencing a woman's risk and survival after a diagnosis of breast cancer. She is interested in disparities research, studying how ethnicity and obesity impact an individual's risk to develop breast cancer. With her research team, Dr. Brewster has also developed a framework for investigating the decision-making process of preventative mastectomy among women with breast cancer. She directs the MDACC's Women's Center Moonshot Prevention project that is focused on increasing the uptake of anti-estrogen preventative therapy among women with pre-malignant breast lesions. With her Komen Scholar Grant, Dr. Brewster seeks to develop a non-invasive blood test to detect both symptom and screen-detected triple-negative breast cancers to rank a woman's risk for recurrence to breast cancer and to decrease over-treatment. Thank you, Dr. Brewster, and if you'd like to learn more about the Komen Scholars, you can visit Komen.org/scholars. That's all for this month. Thanks to everyone who came out and participated at the Komen, North Texas Race for the Cure this past Saturday, May 18th at the Star in Frisco. Despite the rain, we had about 3,000 people in attendance. There's still time to fundraise. June 19th is the last day to submit any donations. Be sure to check out our website for more details. Thanks for tuning in, and we'll see you next month.